Hi, I am Dr. Debashish Das, a surgeon practicing in Chembur, Mumbai for the last 41 years. Hernia basically is a protrusion of a part of the contents of the abdomen outside the abdomen. This is the abnormal protrusion. It can be in the inguinal region or it can be in the anterior abdominal wall. It can be through a normal opening like the umbilical opening or the inguinal opening, or it can be through a scar of a surgery or any injury which has damaged the abdominal wall. Now, when we talk about hernia, we talk about repair of hernia. Repair of hernia can be done in multiple ways. It can be laparoscopic or it can be open. Please remember that laparoscopy is always under general anesthesia in inguinal hernia or in abdominal wall hernia repair. So if the patient is fit for general anesthesia, it is the ideal thing to do it laparoscopically. Now the advantage of laparoscopy is that the stay in the hospital is shorter, the injury to the tissue is less, but then the patient has to be fit for general anesthesia. Suppose we get a case of a hernia which has been done laparoscopically and by someone else and has failed, and there is a recurrence of the hernia, then it is always preferable to do an open repair. When we talk about anterior abdominal wall repair, we talk about mesh. In today's world, mesh is an essential part of hernia repair. Mesh is a fabric which is put inside made of different substances, either absorbable or partially absorbable mesh. Most meshes are made of synthetic material like polypropylene, which are non-absorbable. Now, if we put this in the abdomen, then we have to have a layer of material which will prevent the intestine from getting stuck to it. In the diagram, we will show you the different areas where hernia repair can be done. Now, for inguinal hernia, 90% of the times we do what is known as TEP, that is total extraperitoneal repair. Now, when we do a TEP repair, the patient goes home in the evening or the next day morning, and the repair is excellent in trained hands. If we repair it properly, the recurrence rate is very low, as competitive as the open hernia. Now, even in the open hernia, there are different types of surgery. I prefer to do what is known as modified Lichtenstein's repair, which uses a bigger mesh, and there are different methods which help it retain in the abdominal wall. Later on this mesh, the fibrous tissue develops and the area gets protected. But suppose you have a hernia in which it is very big, or if it is going and getting stuck in the scrotum, then it is better to do a TAPP. That is, we go through the abdomen inside and then come out in the plane between the lining of the abdomen called peritoneum and the tissues outside it. So, in short, hernia can be repaired by open method or laparoscopic method. One of the contraindications for doing laparoscopic repair and choosing an open repair is if the patient is unfit for general anesthesia. Second, if it's a very huge hernia. So this, in short, is what is the treatment for hernia in today's world. Mesh has to be always used. Either it is a plain mesh or a composite mesh. Thank you.